Also with us tonight, MSNBC political analyst Lawrence O'Donnell, contributor at HuffingtonPost.com, former chief of staff to the Senate Finance Committee. Welcome back, sir.
Good to be here, Keith.
All right, Rahm Emanuel, Chris Dodd, Max Baucus, and Harry Reid walk into a bar, and Dodd says to the bartender, "Give me a public option." Or what's the rest of the joke?
Keith, it sounds like a whole new opening for the aristocrats, but we don't have time to do the aristocrats on this show. Listen, it's a situation where they're trying to figure out whether a public option bill can get 60 votes on the floor. It's pretty certain that a public option bill would be it'd be pretty easy to hold it in there, meaning it would take 51 votes to strip it out of the bill. That means the Republicans would have to pick up 11 Democrats to strip it out once it's in there. But the only reason they're pausing is they don't believe at this stage, or they're not convinced, that they have 60 votes to pass it if the public option is in it.
What I just asked the senator, are there subsequent bites on health care reform, or is 2009 it for the foreseeable future?
Well, you know, you saw what happened last time. It took 15 years for this subject to come up again. The Clinton presidency had 6 more years in it after the wipeout on health care reform in '94, and they didn't do a thing on this. Then we had 8 years of Republican presidency. So you get these things every 15 years or so. Now, if we pass this bill, if we pass one of these bills, we'll be coming back to it constantly, because every version of this bill that's currently in the Congress is hugely defective in various ways. And then there will also be tremendous budget-cutting pressure on these bills after they're passed. When the Congress is coming back to do deficit reduction, they won't just have Medicare to cut anymore. They'll be able to cut subsidies to poor people to buy health insurance.
What about pressure in the other way, Lawrence? What about the prospect that something actually is going to work and will be felt, and there might be momentum built in the public and a greater understanding of it if there's actually some model that is up and running?
Well, you'd need 2 things there, Keith. You would need a huge, soaring economy to make the Congress comfortable in increasing benefits. And so what we have for the foreseeable future after passing one of these bills is 10, 20, 15 million people without health insurance, with exactly the same tragic stories that we've been hearing for all the years leading up to this.
What do you know about, and apparently they're calling your bus there at the depot, what do you know about MLR? What do you know about this medical loss ratio? If there's no public option, are there enough other tools to use against insurance costs, and is this one of the better ones?
Well, this would be a very difficult tool to use, because we don't really have a regulatory mechanism in place that could control it to get inside the health insurance companies' books to really figure out what the truth is on that number. I mean, we have enough trouble trying to police them on taxation. We don't do a very good job of that. So this is one of those fallback attempts. The cleanest thing you could do is premium caps, is price controls on premiums. That would be enforceable. That would be understandable and clear, and consumers could enforce it if they saw their premiums going up too high.
So if you don't get the public option, is the best alternative like 16 little darts to pin the insurance industry against the wall like butterflies in a collection? And is that being discussed right now?
Well, that's what they would be working on, but those things are all evadable, I think. I always look at these things from the standpoint of enforcement, because I used to have a hand in writing the tax code, and you think about enforcement a lot when you're doing that, and so I just don't see where the enforcement mechanisms are, and that's why the public option is so useful, is that you don't worry so much about enforcing the unenforceable against insurance companies. You just allow there to be a public option that they have to compete against. I mean, I don't have to make this case to this audience. Everyone knows it. That's what the fight is about. That's what the public option fight is all about.
Something we're going to have to talk about at length. You had a hand in writing tax code?
Well, the Senate Finance Committee does that, and I'm afraid I wrote the biggest tax increase in history, Keith. If you're going to write a tax increase, might as well be the biggest one in history.
Lawrence O'Donnell of MSNBC and the Huffington Post, and one of the guys you didn't know you were swearing at when you fill out your taxes. As always, great thanks.
Exactly.